Perhaps let's take that first set of questions, and I'll start with, Graham's question. He asks, are we in control? And at what point will the government say it is overwhelmed? What I can say here is that, yes, right now, in terms of the triggers we put in place, in terms of, our signals, our alert system, we're very much in control of this situation. It's important to actually reflect and see countries who've gone before us, the Italies, the Spains, and perhaps here in Africa, South Africa. You can see that we're dealing with a public health emergency of huge proportions. And so it takes a lot to be able to say, you've reached the point of being overwhelmed, and I really do not think and I do not envision a point at which we would ever be overwhelmed. We are well seized of the issues. We are putting in place all the interventions, and this is collaboratively with county governments. And so, no, we are not at that point. But do we have a signal? Do we have an alert system that tells us that perhaps here we need to, refocus our energies and resources? Yes, we do. And so we are observing and surveying the situation as it evolves. In terms of our positivity, you've asked how many healthcare workers have tested positive. The numbers, continue to increase. Today, I think I'll ask Dr. Kuria to expound on that, but I'm aware we're at about 500 plus healthcare workers who've tested positive. And yes, at Spinal Injury Hospital, there were cases that were found of positive healthcare workers. However, I'm also aware at Spinal Hospital, certain reconfigurations in terms of their rosters and how they manage patients has been put underway. So service delivery will not be affected. Now, the question is, should this continue? Should these numbers continue to increase? Right now, we are standing at about 3.6% of positivity in our healthcare workers. So out of all the people who've tested positive in the country, about 3.6% are healthcare workers. What happens if this number jumps to 10%? Of course, that would be grave. Of course, that would have implications on service delivery. However, again, we continue to protect our healthcare workers to ensure that they're safe, to ensure that they have the gear that they need, to also ensure that at the end of the day, also you, Mwananchi, can get the healthcare services. Have we made contingency plans for that situation where perhaps we may have a huge inundated number of healthcare workers affected? Yes. Of course, we are working on that to see how do we reprogram our service delivery, how do we ensure our health system would not be, overwhelmed, how do we ensure continuity of health services for all other essential health services. There's a fantastic group of technical experts who are working on this to ensure at the end of the day, even with supposedly increasing numbers of healthcare workers, because that is bound to happen, that you can access your diabetic clinic, that you can access your hypertensive clinic, that you can still get immunization services for your children, you can still go to an ANC clinic if you're a pregnant mother. Enoch has asked a question regarding the incoming flights from 1st of August. Again, this is an issue we've expounded on in previous briefings. In fact, the Cabinet Secretary has spoken to this issue. It's an issue that's still under review with clear determination to be made as we get to August. Remember, our modeling teams have shared with us various scenarios. And one of the ones that was actually being discussed this morning is the peak of August to September and what that would look like. And so with such considerations, with such implications on the ground, this becomes an issue that we should discuss and engage with when that time comes in. That being said, I do remember the Cabinet Secretary did state that yes, of course, issues of quarantine would need to be taken into account of to ensure that we are reducing on any importation of cases within the country. There's an issue of Dandora dump site and face masks. In fact, you don't have to go too far. Right there at Uhuru Park, there's a lot of face masks on the grass. So, of course, it becomes a big issue in terms of how we are managing our waste. One, the responsibility is not only for those who perhaps may manage waste management in terms of NEMA, in terms of regulation. It's you and I, because that face mask got there from a certain nose and mouth that it was covering, right? And so there's an element of responsibility when it comes to how you're able to discard this. I will ask Dr. Kefa, who is here and who has really long dealt with the issues of waste management, to share with you what we foresee in terms of being able to manage this waste, and also in terms of hazards. Remember, we always say in terms of the studies and the evidence that has come forth, that COVID-19 virus is able to last onto surfaces for an inordinate number of days. Some people say from 16 hours to 72 hours. And so it means, of course, there's a risk. If you're working in a dump site, of course, there's a risk in terms of you coming into contact with that mask. But remember, that same dump site also has many other risks. COVID is a new disease, but there are many other diseases that you can actually contract in terms of occupational health when you're working in a dump site. And so, of course, it's an issue that we need to discuss, an issue that we need to provide communication, health education to. So what does it mean when you're working there? How do you protect yourself as you try to clear the dump site? And I think Kefa will expound on this. There's an issue that has been brought on by Purity regarding what is the impact of COVID-19 on services. Again, we've actually just recently concluded the first draft of our assessment of continuity of essential health services. And once that draft is finalized and ratified at the senior level, we'll be able to share it with you. But preliminary results from that draft indicate that in the month of March, all the way to April, May, there's actually a significant dipping in terms of attendances to hospitals. I did see the report, and it noted that we had almost 30% decline in outpatient visits. So in every 1 year, if you're having about, say, 1 million Kenyans visiting a hospital because they're unwell, it means about 30% of them in the times of COVID, the early phase of COVID, decided not to visit a health facility or were afraid to visit a health facility or could not get to a health facility. And of course, that has ramifications when it comes to the health of the nation. We've seen a decline in immunization services, particularly DPT-3, which is an indicator for immunization. We saw about a 20% drop of that. We've seen a decline in deliveries, but again with good news. In the month of May, and like I said, this report will be released soon, we've seen almost a normalization. So the curve went down drastically, but in the month of May, there's a resurgence to near normalization for deliveries and for immunization. We saw very minimal change in antenatal clinics. Again, a curious picture. You know, mothers still attended antenatal clinics more or less. But of significance, when it comes to chronic care condition clinics, HIV, TB, arthritis clinics, gynecology clinics, we actually saw a drastic reduction, nearly almost 40%. And what that means is that our diabetics were not going for their refills to the clinics. What that means is that if our HIV patients were not getting their medication, what that means is that our TB patients were not getting their medication. And so that's a problem, and we have the team. It's worked on guidelines, how to ensure there's continuity of care. It's working to see how we can actually create that confidence back in being able to access a health facility and get the care that you need. Thank you, Purity. We will endeavor to ensure we keep time, and we take note of that inconvenience, and we do apologize for it. With regards to communication, the last question before I hand over to Dr. Courier, indeed, we've had your cries, we've had a lot of feedback from the publics with regards to our communication. We have a very savvy team that looks at all the social media posts. We've seen all the memes about today we have dash cases of which dash recovered, of which dash died. We've seen all that, and we appreciate the council to be able to actually rejig and reform our communication strategy. And so what we've done, today we actually do have new communication officers standing here. So we've recruited new team members who will be working on this. We've revamped our health promotion unit. Health promotion officers have actually developed what is known as a BCC strategy. And I'm glad the person who asked this question was talking about behavior change and communication. So the very strategy that was adopted during the days of HIV/AIDS is what now we are going to adopt. You're going to see a lot of engagement with the community. You're going to see a lot of people visiting marketplaces, a lot of people visiting supermarkets, workplaces, to really engage with the public and to try and define for them and, make them understand exactly what is going on. I think you've seen the cabinet secretary ensure that he's doing county visits. And those have been instrumental. I can tell you, having participated in a few of them, when you head down to the counties, they do appreciate it. Mwananchi does sort of get that realization of why there's need to be able to mask and wash your hands. We have a large number of people now in the field looking, seeing, trying to see how we'll better adapt this BCC approach. So we've heard your call, and this is something that we are now actioning. I think at this point, I'll